Hi there, we're Hasa and Olivia, here to present our harm reduction strategy for Mesa, Arizona to reduce opioid related deaths. Opioid Observation and Treatment Center (OOTC) are safe spaces with support from staff and resources prepared for emergency response and corresponding web app to visualize and predict areas prone to overdosages and best locations for OOTCs. So, the concept of harm reduction refers to a set of policies, programs that aim to reduce the health, social, and economical consequences of drug and alcohol abuse. During the 1990s opioid crisis in Switzerland, safe spaces for heroin usage were introduced as part of the four pillar drug policy, which helped reduce overdosage deaths by 64%. So, the misuse of addiction to opioids including prescription pain relievers, is a national crisis. In 2020, opioid overdosage incidences in Mesa increased by 132%. Mesa County Opioid Response Group was established to identify strategies to address the crisis, with goal to prevent substance misuse, improve treatment access, and reduce harm. Our use case is to establish safe spaces that provide support, safe and monitored injection sites, overdosage treatment, and primary care for heroin users who would otherwise be on the streets. With a user-friendly web app that visualizes urgency and to predict best locations for OTCs, along with resource allocation to mitigate opioid overdosage deaths. So, coincidentally, just after we started our proposal, New York rolled out first ever government approved drug injection sites. New York Mayor, according to a leading newspaper, acknowledges that overdosage prevention centers are the most effective way to address the opioid crisis, which reinforces our proposal to Mesa. Moving on to the wireframe of our app. This would be the landing page. We envision this app being used by both public and health officials, with all the information on programs and other resources on the left side of the screen for friends and family to help their loved ones. On the right is the login page for officials to access the predictive maps and analysis charts. So once we log in, we have multiple tabs for various predictors. For example, to see opioid crisis predicted hotspots, observed opioid overdosage events, and other layers that will be useful can be toggled on and off. This will help health officials decide where to administer service sites. Let's understand how all of these predictive maps are made. So, we start off by using variables like crime, proximity to city facilities, demographics to predict overdosage as a function of environmental factors. To analyze the risk of opioid overdosage evenly across space, we create a fishnet to which we aggregate point data. So, the next step would be the nearest neighbor function to calculate the average distance of each fishnet cell to the closest 3 points of the variable. The last step of the exploratory analysis is to determine whether to use the unaggregated or the nearest neighbor variables. Next, we analyze the correlation of each independent variable to the dependent variable. So, most importantly, to be very sure that our model predicts better than the traditional overdosage hotspots, we check whether risk predictors outperform traditional kernel density hotspot mapping. To add an element of across-time generalizability, hotspot and risk predictors from 2017 overdosages are used to predict the location of 2018 overdosages. Okay, so to round off the positioning of OTCs in the predictive analysis, which are predominantly non-residential zones, we recognize that overdosages can happen in residences, and OTCs will be equipped with health officials and other resources such as ambulances to take care of off-site cases as well. So, concluding on the web app with other features, the other features that it will host will be able to predict future OOTC sites and analyze the most and least used sites that are overwhelmed and underused, and accordingly reallocate the resources. It will also include a predictive analysis for the inventory of the resources at various sites. Thank you.